Good evening, Ms. Schäfer. Thank you very much for your time. We've had sort of different reports around exactly how many teachers have tested positive for COVID-19. Could you just give us the very latest news on how many teachers in the province are now COVID-19 positive and how many schools this is going to impact?
At the moment, we've confirmed publicly that there are 4 schools where we have had COVID cases of teachers. That's the latest stats I've got.
All right. And do you know, are those all teachers that are positive at those 4 schools?
There are teachers that came to school and they did test positive, yeah.
I see. Now, was this picked up when the teachers came back, or did they know prior to this that they were positive?
No, it seems that they came to school with the infection already, not that they picked it up at school. Obviously, each case differs, and I don't have specifics on how each person got it. But the information that I have is that they didn't pick it up at school. They came to school, and it was picked up during the week when they were back at school.
Okay. Could you tell us the name of the schools and whether those schools will now be reopening on Monday?
I've got 4 schools: The Hague in Delft, Parkvale, Kastelsvlei, and Wallisdean Primary School. What we have done is formulated a very detailed protocol that has to be complied with by every school in the event of a case being in a school. We have put all our circulars on our department website, and it can be found there under the Opening the Schools section there. So it gives very clear information as to what is to happen. It depends if an employee is tested positive or is exposed to someone who tests positive, then they've got to follow those protocols. It also depends on how close contact you've had. So it's not necessarily the case that the entire school will have to shut down, but places where those people have been will certainly have to be disinfected and properly sanitized. So we have put that in place. So just because somebody has been in contact, unless it's close contact, as in a handshake or a hug, for example, of someone with a positive case that has been confirmed, they will then have to self-isolate for 14 days, which obviously will affect them being able to be at school.
Yesterday we saw the death stats for COVID-19, and 49 people died in Cape Town. I've spoken to the head of health, Dr. Keith Good, who said this was over 2 days, but he is expecting in the region of upwards 30 deaths a day in the province going forward as the province moves up to its peak. Are you concerned about that in this province, that you're reopening schools at a time when the province is moving into its worst phase in terms of COVID-19?
We're concerned about COVID as a whole, absolutely, and any death is one too many. The thing is, we've got to look at it holistically across the province and across the country, and the decision has, at the end of the day, been made by the National Minister, but we have agreed with the decision given that schools have been closed for 2 months already. So we do need to look at all the factors. Obviously, the status of the infection at the moment in the provinces is a concern. But we also need to look at the purpose of having lockdown. And the purpose of having lockdown is to ensure really that our health facilities are equipped and able to prepare for the increase in cases. And it's very difficult to explain, and it's extremely complicated and complex and emotional. I understand that we're all feeling very nervous about it. But the fact of the matter is the teachers have already got COVID anyway before they even came to school. So they are going to get it anyway in communities, whether schools are open or whether they aren't open. So the reason why we're doing it in a phased approach is that only the grade 7s and the grade 12s will be back from the 1st of June. We will then be able to do all this proper social distancing protocols and health and hygiene requirements, and then see how it goes. I think if there is any strong increase in number of infections, then that may have to change the way we look at it. But there are huge consequences for the length of time the school has been closed for many people who have to go to work and who haven't got anywhere for their children to go. So it's a real balancing act between the economy, saving lives, and also understanding that we cannot eliminate it completely. We can mitigate the risks, as Professor Karim has said repeatedly. We can mitigate the risks, but we cannot eliminate them entirely. So we are confident that we are taking absolutely every possible precaution we can. We're providing our teachers with comorbidities to be able to make alternative arrangements. And children, if they do have comorbidities and that are at higher risk, then we will make arrangements for them to be able to work from home if their parents are happy with that. So I don't think we can really do much more than that. We do need to get the economy going again, and part of that is to enable people to get back to school.
Thank you very much. I really do appreciate your time. That's Debbie Schäfer, Western Cape Education MEC, confirming that indeed 4 teachers have tested positive for COVID-19 in that province. It's affected 4 schools, and we will follow that story.